In this range of motion testing, we are going to be going through hip internal rotation in the supine position. Our optimal range of motion that we're going to be looking for is 40 to 50 degrees. Now our tape setup is going to be the exact same as our external rotation. So we're going right through that patella, right through the middle of patella. Tape is going to be lined up with the front of the ASIS and right down to the middle of the ankle. Now in terms of setup, knee is going to come up, knee right above the actual hip, and we're going to be going into internal rotation. Now, commonly, and I explained this in a previous video for external rotation, people usually confuse this test. So they see the tib fib going this way, so they assume it's going to be external rotation. Now, if I take my hand onto the femur, and if you notice as I do this, my hand is actually turning internally. Now, when we look at some restrictions, what's causing? So if we have a client who cannot get into 40 to 50 degrees of internal rotation, what is going to be restricting this? So let's look at our list. We have the adductors. We have the deep rotators. Now there's 6 deep rotators. In this position with flexion, the piriformis is not going to be one of them. So we have the gemellus both superior and inferior. We have the obturators, both the internus and externus, and then the quadratus femoris also impeding this range of motion. Now if you notice here, we also have some asterisk muscles. We have the TFL and the glute min. And even though these are internal rotators, they will actually impact our ability to go into internal rotation. And the reason being is that when these are very tight, it will actually restrict that joint from moving and sliding that humeral head properly. So, and then, the third thing that we're going to be looking at as well is going to be our core. In a previous video, and I'll kind of go through this again with you guys now, is that our core or our proximal stability will affect our distal mobility. When we move, we require our core to stabilize, everything going on through here. When we become kind of lazy or that core doesn't actually fire or function properly, everything above and below has to take on more load. So usually what starts to happen is when the core does not activate during all of our movements, the hips get tighter to actually save all those structures through our lumbar spine and T-spine. So as soon as we do some core activation, if we notice an improvement in mobility, we would definitely assume that core activation should be something that we put into our corrective protocol. We're also looking at posterior inferior capsule of the hip joint and also at the SI joint. Now, the SI joint, if there's any issues in terms of tightness in that SI joint, it's not moving properly, it will affect all the structures in those deep rotators, causing a lot of tightness as well. So if you do find someone, when you go through these protocols, and you see no improvement, you might want to look at outsourcing and looking at that SI joint to make sure the XI joint in the back of that pelvis is properly moving. So let's go through this test right now. How do you think you're going to do? I know what you're going to do. So, knee directly above hip. I'm going to stabilize, and we're going to go into our internal rotation. Now, what I want you to look at right now is this pelvis, right here where the hip is. If I force that, what starts to happen? So what do you feel right now?
It lifts up.
It's starting to lift up. Let's talk about, so if that TFL and that glute min are very tight through here, and we are internally rotating that joint, that capsule will become restricted. If I want to continue moving this and this, something's got to give. So you'll feel that lift and that rotation in the pelvis. That's a good indication, and that's why this is asterisk here. This will cause a lot of limitation and restriction through the actual capsule. And you'll notice that with that hip lift and rotation. Now, we're going to stop just before that rotation occurs. So we're going to go, right about here. So hold that for me. And in terms of our angle right now, we are at, you ready for this? 20 degrees. So optimal 40 to 50. We have just a slight issue here. Now, before we start tackling this, let's tackle the core. So we're gonna do 3 reps of 5 seconds of a side plank. So we're gonna go same side plank as the hip that we're testing. So if you don't mind facing the camera here, Sarah. Now a couple side plank 101 before we get into this position. We want a nice neutral head, so we don't want head this way or protruding. Neutral head positioning. We want elbow directly underneath the shoulder as opposed to, just do me a favor and bring it out here a little bit more. We don't want elbow in this position. Elbow in line or directly below the shoulder. Ankle, hip, shoulder, all in one straight line. Now, as Sarah comes up, what she's gonna do is she's gonna squeeze her glutes as hard as she can. She's gonna squeeze the abs as hard as she can as well. Okay, 5 seconds, neutral position for the head. And relax. I want you to breathe out as hard as you can. Squeeze the glutes, squeeze the abs back up. 1, 2, 3, 4, 5. Good, one more time. Deep breath in, up, breathe out. I'm making sure she's activating through here and relax. Now let's retest to see. If we see an improvement, make sure we have proper core conditioning and activation in the program. If we don't, we're gonna tackle all of this. Now, some of the other tests that we've done have already shown some limitations through here. So we do know there's a lot of tightness going on, but let's see if the core activation actually improves her range of motion. So again, knee to chest here, knee right over top of the hip. We're gonna go into rotation. So lifting right there, hold that for me. And now we have, turn that around. We have 40 degrees. Now, how does that feel in terms of tightness?
Better.
A lot better. Now, when we did so internal rotation was improved by the core. In a previous video, we also did the external rotation, and we also found the same results. So, looking at this, I would definitely make sure that we incorporate proper core activation, not just abs, not just crunches or leg lifts, but proper TVA, obliques, proper core activation exercises to let her brain know that this can stabilize her body. That will greatly improve her hip mobility as well. Combine that with some proper self-myofascial release, proper mobilization and stretching, and then activation of the deep rotators, the adductors, and also TFL, glute min, glute med, she'll notice a huge improvement in her hip mobility right away.